Hello everyone, I'm Dr. Ashwin Tamhankar. I'm a consultant urological cancer surgeon and robotic surgeon. March month is considered to be Kidney Cancer Awareness Month, and we have World Kidney Day in this particular month. That's why we are talking about kidney cancer awareness in this month. Let's talk about causative factors or etiological factors for this particular cancer. So most importantly, smoking is very much associated. Industrial exposure of chemicals is second cause, and long-standing obesity and hypertension, raised blood pressure which is accelerated or uncontrolled, these are the risk factors for these tumors. Not necessarily that if you will develop a cancer only if you have either of these factors. These days, majority times, these cancers are developing at a younger age without a definitive cause to be found. In health checkups, these masses are diagnosed at a very early stage in which patients are generally asymptomatic. As the stage progresses or the mass becomes larger in size, the overall patients will develop symptoms which can be either pain in the flank or pain in the tummy or bleeding in the urine. These symptoms are to be picked up at a very early stage. Always remember that pain in the flank or bleeding in the urine is always abnormal. Bleeding in the urine, in medical terms, we call it hematuria, which means heme as blood in urine, can never be normal. So please do not extrapolate this to stone or infection on your own. Do report these symptoms to the clinicians, the doctors, urologists or uro-oncologists, and get yourself evaluated for this. Now, most importantly, in a diagnostic algorithm, how do we manage these patients is by a battery of tests, which will have either first sonography evaluation followed by a CT scan of the abdomen and chest. PET scan is an option, however, it's not something which is compulsory. A good standard CT scan of the abdomen, pelvis and chest completes our workup. Generally, biopsies in these tumors are never contemplated when patient is quite fit to undergo a procedure under anesthesia because of various reasons, especially because biopsy has a chance of false negative rates. Biopsy comes with some consequences and complications of bleeding. Biopsy can potentially lead to theoretical seeding of cells out of the tumor. That's why potential theoretical spread, chances of spread. And generally, biopsy does not change the way the management of these tumors should happen. That's why biopsies are extremely reserved for rare case scenarios where you have a suspected spread already of a disease, or you have a diagnostic dilemma between infective etiology versus a cancer etiology. Based on the imaging, we have to take some percentage possibilities of cancer and take things forward accordingly for the management. Thank you.